Thanks for your patience for all the participants.
Yeah.
Now, just a small few words about the doctor. So he is going to present on the ABCs of osteoarthritis, an integrative approach to manage the knee OA pain. That is today's our objective webinar topic. And Dr. Dinesh Manni is going to present on this. Doctor, next slide, please. Before going to hand over the session to Dr. Just I would like to add some few words about Dr. Dinesh Manni. What is his area of interest and where he is practicing and all. Just I would like to add some few points to Dr. Dinesh Manni. Dr. Dinesh Manni is an orthopedic surgeon. Currently, he is practicing at Manipal Hospital, Vartur Road, and he is expert in especially on the knee injuries. Especially, he's treating a lot of complex trauma surgeries, trauma cases, and he is expert in deformity correction. And he is an expert in knee arthroscopy, especially arthroscopy in the sense, if people know that it's a keyhole surgery, and he is a specialist in keyhole surgeries, knee arthroscopy, especially in the knee segment. And he participated in lots of research work, and he has done a lot of workshops, and he is an active member of Karnataka Orthopedic Society and the Bangalore Orthopedic Society also. Okay, he's having a great experience in treating a lot of patients with knee pain. With that, I would like to again welcome Dr. Dinesh Manni, and I welcome you all. Thank you everyone for joining this session. So let us listen the doctor's presentation first, then we'll move on. Thank you very much, doctor, for giving the opportunity. Once again, I'm very grateful to you for this wonderful evening you are joined for this webinar. Thank you very much, doctor.
Yeah. Thank you, Mr. Ramesh. Yeah.
Yeah, you can take it now, sir.
Yeah. Thanks for the kind words. Thanks for the introduction thing. So, good evening, everyone. So, my name is Dr. Dinesh Manni. I'm an orthopedic surgeon and currently practicing in Manipal Hospital, Vartur Road. So, today's topic is the APCs of osteoarthritis. So, basically, I'll be covering more on the non-operative methods, like the treatment options of osteoarthritis and all, which everyone will be interested to listen to. So, starting with that thing, what is arthritis? So, arthritis is nothing but the wear and tear of the joint. Every joint is lined by cartilage. In arthritis, the cartilage wears out. So basically, as a definition, we call it as the inflammation of the joint. So which leads to stiffness, pain, ultimately leading to disability and all, because it restricts the movement of the joint. So ultimately causing so much of disability to the patient. And if you see the slide, so the left of the point, if you see on the left side of the image, that's how the healthy normal joint looks like. Now you can see the whitish one is nothing but the cartilage. So the bone ends will be covered by cartilage, and the cartilage moves, the two bones move over the cartilage so that there won't be any friction at all. Coming to the right side, if you see it's more of like arthritic joint image where the cartilage is totally worn out. So when the cartilage is totally worn out, the nerve endings, the bone ends are nothing but the nerve endings. The nerve endings rub against each other. That's where the pain starts. So there is no one is immune for arthritis. Arthritis can affect anyone at any age and all. So when it comes to the arthritis, we usually basically classify into primary and secondary arthritis. So primary itself, primary, it states that it is more of the reason is unknown. It is more of age related. As we grow older, how each and every joint in the body it tends to wear out. So that is more of a primary arthritis where there is no underlying cause for the arthritis. At the same time, there is a secondary arthritis, so where there is some sort of secondary underlying causes there, like some sort of inflammatory, like rheumatoid arthritis, can be ankylosing spondylitis. A lot of patients, they do suffer with the gouty issues like uric acid issues, which in turn leads to secondary arthritis and all. So ultimately the thing is no one is immune for this arthritis thing. So each and everyone has to they can get affected with the arthritis thing. So what are the warning signs? What are the early signs and symptoms of any arthritis, whether it can be a primary or can be a secondary? The most common symptom anyone can have is more of the pain. The pain, the second, followed by stiffness. Sometimes there will be a bit of locking, sometimes instability. Arthritis can give rise to instability. So that's the reason, like, most of the times, like, when patient comes to us in OPD, so more than the pain, they say more of like stiffness, especially knee arthritis. They say, doctor, I got more of stiffness. The moment I sit for some time, when I try to get up, I won't be able to walk. The moment after 5 minutes, when after like some sort of doing some sort of adjustments in the knee, then I will be able to walk a bit. But walking after short distance, again they start having pain and all. The most common disability they'll have is like restricted mobility. So restricted mobility intent, like, it leads to more of like increased weight gain and secondary complications. Like most of the times, these sort of like secondary, like primary arthritis, we see elderly people. So who will have like associated comorbidities like diabetes, hypertension. So all these sort of secondary issues, comorbidities and all. So where mobility is like a very important thing, because restricted mobility can leads to like increased sugars and all those things. So it is just like a vicious cycle. Because like it's more of the pain, which will like a pain will restrict your movement. So in turn it causes weight gain, and weight gain can cause like all the secondary issues of the weight gain, like obesity, like no uncontrolled diabetes, like cardiac issues and all those things. So the most common symptoms will be like the pain, stiffness, locking, knee joint locking, and of course the instability. And this is how the like arthritic, like if you say take any normal x-ray of the knee joint. So if you can see the left side x-ray of the normal knee, the normal knee joint, if you take an x-ray, any like weight bearing x-ray, you see a nice gap, like we call it as a rectangular gap. It's a symmetrical rectangular gap on both the sides. So that is how the normal x-ray looks like. The gap is nothing but the gap there. It is a cartilage which you can't see it in the x-ray that appears. But the same thing, if you look at the right side, like the right side x-ray, so if you see there is hardly any gap left. So that means there is no cartilage left. When there is no cartilage left between the two bones, the bones rub against each other, which causes like immense, like intense amount of pain and all. So this is the animation image showing like more of like how the arthritic knee looks like. You can see the like normal like knee, how the cartilage, it's like just like a highly polished structure. In an arthritic knee, it's a worn out cartilage with the exposed underlying bone. The underlying bone is nothing but a subchondral bone. We call it subchondral bone, which has got a lot of nerve endings. So when the nerve endings get exposed, it causes immense pain, especially on weight gain. So this is a simple like diagram like which tells us the normal knee alignment. You see the extreme left side, that is how the normal knee alignment looks like. In human thing, like what happens, there is like one thing called anatomical axis and the mechanical axis. So the mechanical axis is the one which plays an important role, especially in developing this arthritis. The normal mechanical axis, like that is what the weight bearing axis, the entire amount of your like the whole body weight when you stand or when you're walking, when you're getting down the stairs, the mechanical axis or the weight bearing axis tends to go more towards the inner side of the knee. It is not in the center, it is more towards the inner side. I'll just show the image of that. Just see that thing. Can you able to see that one? Image of, can you see that?
Sir, we are able to see that, sir.
See, right? Yeah.
Yeah.
So if you see that, like it is how the normal standing, it is a more of like model of the knee joint.
Sir, maybe you can, sir, sorry to interrupt you. Maybe you can close to the camera.
Yeah, that's what. So if you see the normal, when you weight bear, the normal weight bearing axis goes more, if you take, this is the outer side of the knee. You can see the fibula bone, the tibia bone, fibula is on the outer side. So this is if you take this as a center, this is the center of the knee. The mechanical axis, the weight bearing axis goes more towards the inner side. So that is what you call the medial compartment. So that's the reason most of the times the arthritis, the primary arthritis starts more the joint tends to wear out on the inner shock absorber. That is what you call like the varus deformity. You see the same thing on the slide. The extreme right one, that is a varus one. If you see the thing, the knee is like it tends to wear out on the when the knee tends to wear out on the inner side, it tends to go towards the varus. Like it's go like the inner shock absorber is worn out. It tends to like deviate like this. We call this as a bow leg. In a simple terminology, we call it as a bow leg. So the moment the knee is like what happens when there is like a bow leg, the lever arm, the more of like the joint reaction force, the ground reaction force, lever arm increases, further adding to the wear out of the inner shock absorber. So basically, this is very important. Like when you are doing some sort of like surgical options, especially braces works on this principle. So the braces works. So like we'll talk about how the braces works. So basically, by applying any brace, we are trying to offload the already very already worn out inner compartment, so that the body weight goes more towards the non-affected side, that's the outer side, or towards the center of the knee joint, so that there is some sort of distraction happens on the inner shock absorber, so that there is not much of wear out happens. At the same time, the pain also reduces because the bones are not rubbing against each other by applying any sort of brace. We call this as offloading braces. The same thing happens in a valgus knee. But in clinical practice, most of the times, like 90 to 95% of cases, we see a bow leg deformity, like a varus deformity, because the primary arthritis. This valgus is otherwise like we call it as a knock knees and all. We see in more of secondary arthritis, like rheumatoid inflammatory arthritis and all. So in clinical practice, we'll be interested more more about to talk about the varus deformity, which is the primary osteoarthritis. So in other simple terminology, we call this as more of a bow leg deformity. So this is a small video. So small animation, a video which tells us what happens exactly in arthritis thing. So there are few risk factors who can get affected with osteoarthritis. As I already mentioned, anyone can get affected with osteoarthritis, but there are few risk factors. So we usually classify these risk factors as modifiable and non-modifiable. So modifiable in the sense where patient can there is some sort of lifestyle modifications where they can make, so that they can avoid these sort of issues in those. So non-modifiable, so where we don't have to any control over that. So especially the age group. So as you grow older, definitely every joint tends to wear out. And the sex, female sex is more affected, almost 2 to 4 fold increase in hip and knee arthritis compared to male population. And other thing is more of ethnicity also. Compared to your Indian population, Western world they're affected more with the osteoarthritis thing. And last but not least, more of a genetic factor. So, a lot of patients they do ask this question: Doctor, my mother has got arthritis. No, do I get arthritis? Because a lot of times I see young females coming walking to OPD asking at the age of 30 years when they come with knee pain, not the arthritic pain. We get multiple other issues also like chondromalacia, patella and all. They ask the first question do I get? My mother has got the arthritis. Do I get arthritis also? So one way it is true because it is more of a secondary arthritis usually runs in families osteo apart rheumatoid arthritis, Angst-Bond, these sort of issues they run in families, but not the osteoarthritis. But osteoarthritis has got bit of genetic role. But it doesn't mean that when your parents are having osteoarthritis, you get osteoarthritis, but the other way. Most of the times it is more of a genetic mutations, which it depends on multifactorial thing. Might be environmental factors, dietary, so much a lot of things involved. And coming to non-modifiable, these are the non-modifiable things. And coming to the modifiable factors, so modifiable in the sense patient's body weight, a BMI. So knee, as everyone knows, knee is a weight-bearing joint. The more the body weight, the more joint reaction force on the knee, the joint tends to wear out. So definitely obesity is a very significant risk factor. And apart from that thing, any like the secondary like injuries, if you have any knee instability like ligamentous injuries, so these sort of a things needs to be addressed immediately, because like any meniscal injuries, ligament like ACL PCL injuries can lead to secondary arthritis, like this we call it as a post traumatic arthritis. So apart from this thing, like high impact activities, like especially like sports persons, like military, like more of like paramilitary, military individuals, like even runners, athletes, they are at risk of developing this sort of arthritis. And more of sedentary life also. Sedentary life can cause like can increase your risk of arthritis, because as you are talking about the sedentary life, so basically knee has got the cartilage. Cartilage doesn't have any blood supply. So cartilage basically gets its nutrition from the synovial fluid, which is a fluid which is there inside any joint. The nutrition, like usually, it gets from the synovial fluid. The synovial fluid circulation happens when there is mobility. That's the reason, like whenever any patient with even arthritis comes to us, like we tell them walk within your pain limits. So sedentary life will further increase the risk of like worse like damage in the joint and all. So these are the things. Apart from these things, like there are certain other conditions like gout, uric acid issues, like high like hyperuricemia, because of more protein consumption. So definitely hyperuricemia can cause more of like joint damage. So these are the like more of like modifiable factors which you can like by controlling the weight, and especially like Indian like more of like Indian continent, subcontinent, like we are used to this sort of lifestyle, like sitting on the floor doing squats, Indian toilets, these sort of things, like they worsen the stress on the knee, they increase the load on the knee like almost like 10 times the body weight by doing these sort of activities. So that's the reason like we tell the bit of like lifestyle modification the moment you start any sort of like early arthritis and all. So like trying to avoid sitting on the floor, avoid like minimize the staircase usage, and avoiding Indian toilets, these sort of things. So these are the modifiable factors. So where we controlling the body weight and doing regular exercises, regular walks, and bit of like like avoiding these sort of like activities like sitting cross-legged on the floor, minimize the stairs usage, and avoiding Indian toilets and all. So when what is the investigation? Like a simple X-ray will tell us like what sort of arthritis you got. So usually most of times, like a lot of times, patient comes to us with a non-weight bearing X-ray. But we would, as a surgeon, we would be interested to look into like more of the weight bearing X-ray. So weight bearing X-ray will tell us the exact like staging of the arthritis things. Like what like usually we grade the arthritis into grade 1 to grade 4, depending on the X-ray findings. So grade 1 being like more of like early arthritis, and grade 4 being the advanced arthritis. In simple words, when the bone is touching on the bone, when the bone is rubbing against the bone in a standing X-ray, that is advanced arthritis, nothing but the grade 4 one. So we don't need an MRI to diagnose the arthritis, which is a simple X-ray, simple weight-bearing X-ray of the knee will tell us like what stage of arthritis it is in. So coming to the treatment options, which will make interested, but I'll be talking more on the like non-surgical options. So most of the times it's the painkillers. So bracing, like there's a lot of braces available in the market, and bit of like physio, and the few like nowadays like a lot of patients they do come to us asking for injections. Like what is the role for injections and all. So I'll be focusing more of like on these options. So of course, last but not the least, like in advanced stages, like we do suggest like knee replacement. So I won't be talking much on the knee replacement now. So coming to non-surgical options. So first thing is like now, as I said, the cartilage is a vascular structure. Cartilage doesn't have a blood supply. So that means once the cartilage is worn out, it is worn out for the life. You can't replace or rebuild a cartilage by giving medications or by doing any surgeries and all. That's the reason, like when there is advanced arthritis, when the cartilage is totally worn out, we do a knee replacement surgery, but you can't replace any sort of cartilage and all. That's the reason, like almost like wear and tear is a disease which can be like it can't be like curable. So coming to the first treatment, like non-surgical options, the medications. So a lot of patients they do like take like supplements and all, like glucosamine, chondroitin, collagen, these multiple things and all. Like so, actually the guideline states that none of these things will help you. But like there are like in Indian population, like in Indian like pharmaceutical industry, they do mix up like a lot of Ayurvedic supplements in our regular glucosamine and all, like Boswellia extracts and all, like bark extracts, which has got a bit of anti-inflammatory function. So they will definitely help you in relieving the pain and stiffness, but not to rebuild your cartilage. But what the companies, like most of the pharmaceutical companies, they state that they will rebuild your cartilage, which is not true. So they are like more of a symptomatic management, just to relieve your pain and stiffness. But they do like, because like we do get a lot of feedback from patients stating that after starting the medicine, they feel a bit better. not like 100%, bit better. Since these supplement doesn't have any sort of issues, like no side effects associated, so we also tell them they continue. There is no issues with that thing. Since we have not seen much of long-term like side effects with these things, so they can safely take these medications. And second thing is the most commonly like the painkillers, which can be the which are like very badly abused, and like that thing like using painkillers can cause a lot of renal issues and GI issues. So when it comes to painkillers, basically we use more of like opioids, because opioids are the ones like more of opium derivatives, which act centrally on the brain, which like relieves the pain. So it doesn't have any renal issues and all. But painkillers also like definitely work on to a certain extent, not like it won't relieve your pain 100%. So definitely medications in osteoarthritis are not a good option, considering the side effects associated with the medications and all. And the second thing is physio. So physio, when it comes to physio, we tell them like more of like it's more of like a pain relief, pain and stiffness to relieve the stiffness and all. It is not going to like cause any sort of like changes in the cartilage which is already damaged. So again, physio, we like we categorize those in modality therapies like doing IFT, TENS, like ultrasound, shortwave therapies and all. So basically, this works on heat, like the heat principle. So basically, if you apply heat to any stiffened structure, the muscle relaxes. So definitely, stiffness is one of the symptoms in arthritis. By applying these sort of heat therapies, the soft tissues expand and the local blood flow increases to that area. So definitely, it helps a bit of like relieving the stiffness. Once the stiffness gets better, patients feel bit of like pain relief also. And physio is quite expensive. We can't like do it as like day-to-day basis and all. So this is for acute things, like acute phases where there are a lot of like severe pain, which is like affecting patients' mobility. We can like take it as an alternative thing for a short term. And once apart from modalities, we can do a bit of like strengthening exercises. Strengthening exercise will definitely help you in early stages, but not in advanced stages. And coming to the role of intraarticular injections, like they are like basically what are the current recommendations we like which are universally accepted. We can give either like a PRPs, like the platelet-rich plasma, and the hyaluronic acid and the steroids. So each one has their own benefits and all, and there is a lot of price variation. So definitely like I do like give a lot of PRPs nowadays. Like comparing the latest studies shows that PRP is much better advantage than giving steroids and hyaluronic acid and all. And these are the exercises which we usually recommend. So any therapist, but exercise will definitely help in earlier stages, but not in advanced arthritic stages. And the topic of interest today is like more of like offloading braces. So basically, as I said initially, these are the braces. What they do, like more of like they offload the affected compartment of the knee. If you see the normal knee, so normal knee has got like two compartments. As I said, like one is the inner compartment, the middle compartment, and the lateral compartment. In varus deformity, the bow leg deformity, the inner compartment usually wears out. So by applying the offloading brace on the outer side, so by distracting the medial side, the joint opens up. By doing that, the body weight bearing axis goes more towards the center or towards the lateral aspect. So which is a normal like compartment, so that it helps in pain relief. So usually patient after applying the knee brace, they feel like instant pain relief and all. So by this works on more of like a weight distribution principle. So whatever it transfers the load from the affected side to non-affected side. So by like you can like depending on the deformity, whether it can be varus or valgus deformity, the brace can be like there are multiple options in the braces, and it comes in various sizes and all. And it is like quite like easy one, like even elderly patients they can apply the braces and all. And there are certain, apart from braces, we get this compression knee braces, which are the most commonly used ones. So basically, these are not the offloaded ones. This works on principle of like by applying these braces, the local tissue blood flow increases, and it causes a little bit of like local warmth. So that works on like a bit of like relieving the stiffness, and they feel better the moment they wear the brace. But this doesn't work as effective as the offloading braces. And to conclude that, so knee arthritis is quite disabling one. So almost like one quarter of the whole world population is like suffering with the knee arthritis, causing like a lot of financial burden to the healthcare system as well. And so to prevent that thing, to prevent developing early arthritis and also maintain healthy lifestyle, doing regular exercises and all, like reducing your body weight, avoid sitting, like a bit of activities which increases your stress on the knee, like avoid sitting on the floor, frequent like using the stairs and all, and squats, especially squat activities, and like using Indian toilets and all. So definitely, like when it comes to medications, so painkillers has got to, like NSAIDs has got a role, but at the cost of renal and gastrointestinal issues. So definitely, like painkillers are not the safe option for non-operative methods for osteoarthritis. Intra-articular injection, they do have help in early stages, but not in advanced stages and all. So physio help in pain relief and relieving of stiffness, and offloading braces are good alternatives. Thank you.
Thanks. Thank you very much, Doctor, for your wonderful presentation. I think you are covered the entire aspects of osteoarthritis. That's why that the ABCs of
Yes.
osteoarthritis. You are covered the entire thing, and you are shown a lot of insights on what are the non-surgical treatment options. That is the important aspect of today's webinar. That you
Yes.
are covered already. Thank you very much for your
Yeah.
presentation,
Thank you,
Doctor.
Mr. Ramesh. Yeah.
Just a small thing to the group. I would like to add the how this offloading braces plays a major role in
Yeah.
treating and managing pain. Just with your kind permission, just 1 or 2 minutes, I
Okay.
will take it
Yes, please.
and
Yes,
I will
yes.
show the presentation to the group, sir.
Yes.
Just a minute. Yeah. You can close your presentation. Uh, Thanks, Doctor, for giving the opportunity.
Yeah.
I would like to talk just few things on about what is the role of braces. Already you are covered in your presentation. Uh, Offloading braces is also one of the better alternative when it comes to the non as a conservative treatment. So just I would like to add some few points to the how the braces, offloading braces will help to the patient. Just I would like to start 1 minute, sir. So what is the primary goal of offloading braces in osteoarthritis? I think already you know that when the doctor presented in his presentation, in this image actually, how the normal healthy joint space, there is a joint space is there. There is a gap is there in the normal healthy knee. But when it comes to the osteoarthritic knee, you can now see that there is a joint space reduction. So our objective is to increase the joint space. So joint space reduction is the key factor for pain and the alignment also. So increasing the joint space is the right option to stop pain and also to reduce the disease progression, because once the joint space increase, the wear and tear will not happen, because there is a good joint space now. The thigh bone and the calf bone will not touch together. The disease progression will not happen further, and it stops pain in some cases, and you can it reduces the pain also in some cases. And what is meant by offloader? Already doctor has explained. It shifts the load from the affected to the unaffected side. That is what it is called offloader brace. Okay. We have a product called freestyle OA, drug freestyle OA. How it works? It applies the forces on the thigh and the calf bone as well as on the opposite side of the affected side, and it pushes open the joint. You can see that now on the image of this. You can see this is the affected one without brace. You can see on the right side image. See that with the brace, how the joint will increase. So once you achieve this with the help of a brace, this is called the offloading brace. That is not possible with the compression. Already doctor also explained very beautifully how other option braces, compression is will help into that. It gives a temporary pain relief. But the ultimate goal of the offloading brace is to increase the joint space. That is possible with this kind of offloading braces. So the product called Freestyle OA from drug actually, what is the benefit out of the Freestyle OA? Easy to apply, as doctor also explained. Even the elderly patient can apply very easily and remove. That is a very easy to get the product. You can see that. And low profile. And the other one, it gives a compression to the patient. Okay, it gives a swelling, it reduces the swelling also. And finally, this is very simple to offload. No need to put different tools or anything. Just a simple thumb wheel dial will help to offload the opposite side. In the sense, it once you rotate, I'll show the video to all of you. Just you see that. From this video, you will come to know that you see that before applying the brace, you see that how the joint space. After the brace, you see the increase in the joint space. Now you can see this from video. You will come to know that.
Make OA braces. Gently apply pressure to the unaffected side below the knee, taking pressure off of the affected side. The higher the pressure on the knee, the greater the amount of force. Before and after X show how Greg's freestyle OA brace affects the knee. Ask your doctor.
So you will already you are seeing this very simple thing actually. Okay, it's very easy to do that, and you can see that normally when after applied the brace, they will go for this type of X-ray analysis also. You can see before brace, after brace also.
And the determination of how much joint space.
Okay, so you need to understand one important thing. Just like that, we cannot able to choose the brace. You need to understand before choosing a brace. Know where your knee arthritis is. That doctor will come to know that from your X-ray, and clinically he can able to identify where is the arthritis affected, whether it is on the inner side of the knee or in the lateral in the sense outside of the knee, or in the below the kneecap. Sometimes below the kneecap also there is a artificial cartilage. There also there is damage. It also leads to pain. You should know that where is the exactly the arthritis. For that you need to consult a doctor. Then you make a decision to select the right brace for you. Whether it is the compression brace or the offloading brace, that you need to consult with the doctor. That will be fine. Okay. So what is the benefits of this offloading brace, especially Breck freestyle OA knee brace? The knee pain will be reduced, or in sometimes it's stopped also, because you know that you have seen from the video, it increases the joint space. The joint, the thigh bone and top bone will not touch together. Obviously the pain will stop, and you can wear without help and walk without any support also. And your confidence also improved. You can walk with the confidence. You will not get any pain. You will not feel any pain while walking. So it helps to increase your day-to-day activities. You can able to do your daily activities. You can enjoy your life, and your knee feels supported. That is what you feel that, and definitely it increases your day-to-day activity level, and can have the choice to wear the brace as per the convenience. Mostly we are recommending braces during the activity level. It is not recommended. It is not enough to wear the brace during the sleep and there is no activity, because the wear and tear will happen only during the exactly while doing the work, your activity level. Okay, that is what our benefits of freestyle is. So thank you very much. Thank you very much, doctor, for your opportunity to.
So I would just like to add
the
this thing.
product.
Like I usually use these sort of braces, especially in people like youngsters. Like nowadays we see arthritis in like more of like 40s.
Correct.
So especially the single compartment, middle compartment arthritis and all, who are not a fit candidate for any sort of like a surgery. So apart from doing a high tibia osteotomy, so these braces just to buy some time. So definitely like these are a very good option. And especially elderly people who are really scared about like knee replacements and who are not medically fit also. So these places will definitely have a very like a major role.
Yeah, thank you, doctor. Thanks for your
That's one thing. So
valuable information. With that, I would like to ask our participants to ask questions. If you have any questions one by one, please raise your hand, and then you will ask one by one the questions to doctor. Now this is the time for you.
Sir, my name is Ramesh. I'm calling from Bangalore only.
yeah, please tell me, Mr. Ramesh.
Okay. See, my both the knees got degenerated. It's almost like 4 stage.
Okay.
My age is 53 years only.
Okay.
Is this brace really works for my knee? Like
Usually, yeah. When it comes to like offloading braces, it works only for a like single compartment, like either the middle compartment or the lateral compartment, not for like bi-compartmental. Because as I said, one compartment should be like healthy and intact. So because we at least we need to have a healthy compartment, either middle or the lateral one. Since you got a bicompartmental or a tricompartmental osteoarthritis, usually this is basically reserved for like unicompartmental.
Okay.
That's one thing. If you have like bicompartmental grade 4, I feel like more of like a surgical options you have to consider.
Yes, sir.
Now you're 53, considering your age, I think nowadays we got the ceramic implants might be a better option. It's like where it lasts at least like quite 25 to 30 years.
Okay. I just want to come and meet you, sir. Where we can meet you, sir? Like
in Manipal, I practice in Manipal, Vartur.
Manipal, Vartur, no? Okay.
Yes, yeah.
Then what about the price of this brace, sir? I mean.
I think costing. I think Mr. I think Ramesh.
Right, sir. Right, sir. It's okay, sir.
Don't worry about that. We are shared the free demo link
All right, sir.
in the
Thank you,
group.
sir.
In the group, actually, WhatsApp group. You can
Okay.
feel the product. We are ready to give the demonstration.
Okay, right, sir. Thank you, sir.
We have
Thanks for
shared
the
the link
information.
in the group. You can see that.
Thank you. Thank you, sir. Thank you.
Sure, sure.
Hello, sir, Umesh here.
Hi, Mr. Ramesh. Yeah.
Yeah, sir, actually, I had recently undergone an ACL operation 3 months
Okay.
before at Manipal.
Okay.
But after that,
Yeah.
I'm facing some issues like the doctor told to have another operation and I'm unable to bend my knee fully, like 180 fully.
Okay.
So how does that, what do you call, how can it be helpful for
Yeah,
me?
that's what, like, most of the times anyways, like, I have not seen the MRI, but according to your clinical thing, maybe like, no, when you're not able to bend it fully, there are like two possibilities. One is there might be a like no bit of an impingement which can happen because of the new graft. The graft might be impinging in the joint itself, which is not allowing full movement, or can be a meniscal tear which might have missed. So these are the two possibilities in your case. So
No,
unless we see the
I did even recent an MRI. They told the meniscus that is not the case. The second one, whatever you told, right?
yeah,
The
that's what
operation-
that's what. If meniscus is not the case, then might be impingement thing. So impingement in the sense when you're using a graft, the whatever the hamstring graft or the patellar tendon graft when you are using, sometimes the graft thickness is so high, or sometimes the notch, like what you call the notch thing. Like now, notch is nothing but when you see the femur bone. I'll just show you the image. So when you put the graft here, right, the graft usually goes on anchors to the thigh bone. Sometimes the graft thickness is so high, or sometimes the notch is so narrow, the graft will be impinging inside the notch here. So that's the reason sometimes you might have to do a bit of notch plasty to improve the notch diameter there. That is what you call the notch plasty. So unless we see the MRI, like we can't comment. But is there anything in the MRI apart from this thing, like meniscus is fine, the rest everything is fine?
Yeah, I recently did an MRI just a
Okay.
week ago.
Okay.
I visited even multiple doctors. They told that's fine.
Yeah,
The
if MRI
MRI
is fine, then because MRI can't pick up the impingement thing. MRI can't pick up the graft impingement. And how was the post-op physio was good? It was good, right? Post-op you had done the proper physio.
Yeah, I
and
did
all.
a physiotherapy for almost 3 months. I took a physiotherapy.
Okay, how much of knee movement you got currently now?
It is almost like 60 to 60 degrees, 60 to
Well,
70.
that's it. That much. Not even
Yes, correct.
only that much. What happens beyond? It starts hurting.
No, it's not like one of the what do you call the backside of knee, right? There are some tendons, right? That is being what do you call? It's like rigid,
Okay.
fully rigid, or what?
Maybe that might be because of post-op stiffness also. See what happens in
Yeah,
like
stiffness.
was there like proper duration between your when was the injury?
It was some
Yeah.
4 months before.
4 months before, and how many
Yes, yes.
days of like how many weeks you waited for the surgery from the
For operation?
duration? Yeah, for the surgery from the time you got this injury. So like how many
2 weeks.
like you
After 2
waited?
weeks, after
Yeah, and
2
how
weeks, I
and how
undergone
was
an
your
operation.
correct? And how was your post like pre-op movement? Post injury and pre-op movement. How much was the movement? Was it like good or full
I
movement
don't
you got?
remember
Or-
exactly, but after post operation,
Yes.
it was like there was a physiotherapy coming, and every month he was doing. After
Yeah,
3 months, there was like no much outcome.
That's what. So that is quite sad. Actually, you got only 60 to 70 degrees was like very poor result. So what are the time? Most of the times we see like when the pre-op movement, because post surgery sometimes there will be a lot of like knee swelling, knee effusion and all. So that's the reason we usually subject them to physio pre-surgery itself. At least they should get their full movements before we take them for surgery. Otherwise, they end up having like post-op stiffness and all. That might be one of the possibility in your case.
So what is the solution now, sir? Now the doctor is telling to go for another operation, which I'm not willing to go now.
I'm not sure. I'm not sure about what surgery he has suggested now. Either like no, we like no, as I said, like might be impingement thing or might be because of the stiffness. When there is like post-op stiffness, we do one surgery called quadriceps plasty, where the muscle,
Not
especially
that,
the
sir.
quadriceps.
He was telling
Yeah.
not that operation. It was ortho.
Arthrolysis, right?
Something. Yeah, maybe.
Okay. So anyways, like we
Sorry,
need to look
yeah.
into that thing clinically. Like no, unless we see the MRI, we can't exactly tell you like no, what's next. Like no, better option though.
Okay.
Thanks,
Does the
Umesh.
knee help me,
Thank
sir?
you. I hope.
Sorry?
Does the knee can help me in any way? I'm able to walk and other things I'm able to do independently now. Does the knee can help me?
Yes. Which one? The braces you are saying?
Yeah, the braces. Yeah, the knee brace or whatever you're showing, right? That can help me or
No. The thing is, you are already having a lot of stiffness. So I don't think braces are not the correct option for you. Definitely not an option. Because if your knee movement is very bad, so 60 degrees, which is not an acceptable thing post surgery. So definitely we need to look into the root cause, like why you're not getting that sort of movement. Either it's the stiffness or might be impingement. We need to look into these two causes.
Can I share my MRI report? Is there any way can
No,
you
definitely. You can. We'll definitely put in my mail this thing. I'll ask them to share the mail thing, not an issue.
Sure. Thank you. Thanks a lot.
Yeah, definitely.
Umesh, thank you very much. We will share the doctor address also and contact details. Maybe if you want, you can go and meet personally and get the help from the doctor.
Sure. Thanks a lot.
Thank you.
Hello.
Next.
Hello, sir. Hello.
Yes, please tell me.
Yeah. Sir, I'm Maria.
Please tell me. Yeah.
I'm from Bangalore, sir. Can you understand Kannada, sir?
Yeah, please. ಹೇಳಿ
ಸರ್ ನನಗೆ 53 ಇಯರ್ಸ್.
ಓಕೆ.
ನಂದು 2 ಜಾಯಿಂಟ್ ಲಿಗ್ಮೆಂಟ್ ಕಡಿಮೆ ಆಗಿದೆ.
ಓಕೆ.
ಇವಾಗ ಏನಂದ್ರೆ ಸ್ವಲ್ಪ ನಡೆದಾಡಕ್ಕೆ ನನಗೆ ಕಷ್ಟ ಆಗ್ತಾ ಇದೆ.
ಓಕೆ.
ಅದಕ್ಕೆ ಹೆಂಗೆ ಸರ್ ಏನು ವಿತೌಟ್ ಆಪರೇಷನ್ ನಾನು ಚೆನ್ನಾಗಿ ಆಗ್ಬೇಕು?
I think after X-ray ದಲ್ಲಿ if it is like more of like early arthritis ಆತರ ಇದ್ರೆ definitely braces will help you. ಇದು braces help ಆಗುತ್ತೆ.
ನನಗೆ rheumatoid arthritis ಬೇರೆ ಇದೆ ಸರ್.
Rheumatoid, you are known rheumatoid arthritis, is it? Okay. So mostly rheumatoid ಅಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ most of the times it will be like tricompartmental osteoarthritis ಆಗುತ್ತೆ. That's the reason you are developing early arthritis. Now usually arthritis ಎಲ್ಲ you will see above 55 age ಅಲ್ಲಿ. But when you're developing early arthritis, and mostly it might be secondary arthritis, like inflammatory arthritis, like rheumatoid arthritis, etc.
ಹೌದು ಸರ್.
So rheumatoid arthritis ಅಲ್ಲಿ mostly if you have fortunately if you have only single compartment X-ray ದಲ್ಲಿ only if it is only unicompartmental arthritis ಆದ್ರೆ definitely braces will help you. But if it is like tricompartmental ಆದ್ರೆ braces will not help you. But rheumatoid ಅಲ್ಲಿ most of the times it will be tricompartmental. ಯಾಕಂದ್ರೆ rheumatoid is like more of a diffuse phenomenon ಅದು. So body ದಲ್ಲಿ almost ಎಲ್ಲ joints affect ಆಗುತ್ತೆ.
ಹೌದು ಸರ್.
So totally osteoarthritis is totally different mechanism of arthritis in rheumatoid.
ಹೌದು ಸರ್.
It is not like osteoarthritis. But once the X-ray ಮಾಡಿದ್ರೆ ಗೊತ್ತಾಗುತ್ತೆ. If it is like more of like middle compartment, single compartment, other definitely braces are the better option.
Okay.
Definitely you are young because 53 we consider as a very young for knee replacement. So usually we reserve knee replacement like beyond 60 and all. Nowadays with the ceramic thing, so above 55 we can safely do that because ಇದು knee operation ಮಾಡಿದ್ರೆ if that ಅದಕ್ಕೆ ಲೈಫ್ ಸ್ಪ್ಯಾನ್ ಇರುತ್ತೆ. Usually normal any like knee replacement 20 to 25 years ಬರುತ್ತೆ ಅದು.
Okay.
So that's the reason ಅದು minimum 55 to 60 is the cut off usually we keep ಇದು. ನಾವು usually 55 years ಆದ್ಮೇಲೆ ಅಂತ.
Okay.
So if X-ray ಒಂದು ಮಾಡಿಸ್ಬಿಟ್ಟು ಅದರಲ್ಲಿ if it is more of like middle compartment arthritis ಆದ್ರೆ definitely braces is a good option.
Okay sir. Okay.
Work ಆಗುತ್ತೆ, definitely will work.
ಓಕೆ ಸರ್, ಇದು ನನಗೆ ನಿಮ್ಮ ಅಡ್ರೆಸ್ ಮತ್ತೆ ಫೋನ್ ನಂಬರ್ ಶೇರ್ ಮಾಡಿ.
ಶೇರ್ ಮಾಡ್ತಾರೆ.
ಓಕೆ, ನಿಮ್ಮನ್ನ ಬಂದು ಭೇಟಿ ಮಾಡ್ಬೇಕಾದ್ರೆ ಹೇಳಿ ಸರ್. ಅದು
ಇಲ್ಲಿ ಮಣಿಪಾಲ್ ನೋಡಬಹುದು, ಮಣಿಪಾಲ್ ವರ್ತೂರಲ್ಲಿ.
ವರ್ತೂರಾ? ಓಕೆ ಸರ್, ಪ್ಲೀಸ್ ನನಗೆ ಶೇರ್ ಮಾಡಕ್ ಹೇಳಿ ಸರ್.
ಡೆಫಿನೆಟ್ಲಿ.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು ಸರ್.
I am Prashanjit. I wanted to know if genicular artery embolism is a solution for arthritis.
Correct.
If it is slightly late stage.
So that's what it is. Not the embolization thing. It's like mostly they used to do this the genicular nerve. Now like it is nothing but basically we are just trying to cauterize the nerve like so that you won't feel any pain at all. So this was like hello.
Okay.
Yes, sir, that's what like basically this is like when you have a middle compartment arthritis and all. That's definitely it has gotten role. But usually this was done by more of like intervention radiologists. They do this one. But we have seen, but it is more of a temporary thing, sir. They come back because arthritis is not like a single, gradually they develop like a tricompartment. It's a progressive thing. It works for it definitely works. It has got a role, but not like a permanent solution. We have seen few patients, they are happy for some time, again they come back with when the arthritis progresses to lateral compartment, they'll have the same sort of pain again. Yeah, definitely for young patients, we can keep it as a rule. But I suggest instead of going for that one, I think you can use a brace which gives almost the equal result.
Okay. Okay.
That's definitely better
But
option.
specialist has to evaluate whether the brace will be
Yeah,
useful,
definitely,
right?
definitely, yeah, definitely. Definitely, only
Okay.
thing is like, yeah, definitely, they are like, I think there are like professionals who come and do the demo and all for you, because like there's a way how to use that thing. Because if you don't apply, if you don't use it properly, definitely like the brace won't work.
So what do they need? Do they need an X-ray or something
Definitely,
before
sir,
they do
definitely,
that?
definitely, definitely. You need to see the what sort of arteries, whether it's a knee compartment or a tri-compartmental thing.
Okay. Okay.
Yes, sir.
Hello, sir. My age is 42.
Okay.
My X-ray is showing patella is moving up when I bend the knees. Actually,
Yes, yeah.
is it related to osteoarthritis?
No, this is not asked. This we call it as a mal tracking of patella. And did you have any like previous episodes of dislocation, anything like kneecap dislocation
Uh,
in the past?
no, no. I think it happened just because of my job sitting at
Okay.
in
See, the
front of
thing is like
system.
this is totally different thing. So what happens in patella moving like abnormally, that we call as a mal tracking patella. So this is not at all arthritis thing. This is totally a different one. So we need to look into
Okay.
like what is the reason for that thing. So just like sitting job will not cause this sort of issues. Sometimes like most of the times we see this condition, especially post injury, any sort of injury, where the kneecap dislocates begins with kneecap dislocation, or sometimes people can have this mal tracking issue without any injury, like people with generalized ligamentous laxity, where the ligaments are very stretchable. So
Okay.
these are the two conditions where you can get these two sort of like this sort of mal tracking issues.
Okay.
So
Will
yeah,
braces help in this case?
yeah, no, definitely braces will help, but not the offloading one. We need like what you call the patella stabilizing braces. I think
Okay.
they do have that thing. I think, yeah, definitely Greg has got that sort of option. Brace will definitely.
Sir, we do have, sir, actually,
Yeah,
that
that's what
for
it has
that.
got. Yeah,
That we will
definitely
do
brace will
it.
help you. So along with braces, you need to do bit of like BMO exercise as well. Physio with the braces.
Yes, sir. I'm doing physio every
Yeah,
day.
physio along with the braces definitely like you. It will definitely help.
Okay, sir. Thank you.
You're welcome.
Is there any questions from the participants from the group? You can ask. Otherwise, I have certain doctor. I have some few questions in the chat box, sir.
Yes, please. Yes. Please.
Sir, how effective is the PRP for knee pain of stage 2 or stage 3?
Yeah,
I think
correct.
you are
Yeah,
already addressed, but for the betterment
correct.
of the group,
Yeah,
you can
most of the
say.
times I prefer giving PRP. So the thing is like when it comes to injections, so good old like previous days, like most of the times the steroids were the most favorite. Like no, these are the favorite for a lot of surgeons. But the problem with steroid is like a long-term usage of steroids can cause bit of like local immunity compromise. So it weakens, it softens the bone. It causes bit of like localized osteoporosis and all. So now with the PR, but so basically the steroid works basically by reducing the inflammation. It's a very powerful anti-inflammatory. It reduces inflammation, but it doesn't have any role on like to alleviate your like cartilage growth or anything. So with PRP is nothing but the plasma. So we take plasma out of your blade and we inject into the knee joint. So PRP like the plasma contains a lot of growth factors. As I said already, hyaline cartilage. When you say the knee cartilage, again, cartilage are different sorts of cartilage. So normal articular cartilage, hyaline cartilage, and other sort of cartilage is a fibrous cartilage. So hyaline cartilage, we can culture in vitro, like, but definitely we can't do any cartilage building surgeries and all. But definitely we can culture cartilage outside the body, but not inside the body. So basically, once the hyaline cartilage is damaged, it is damaged for the rest of your life. So plasma, it contains a lot of growth factors, which helps in building the fibrous cartilage. So it forms a layer of fibrous cartilage on the damaged, like whatever the exposed subchondral bone. So definitely it helps in building your fibrous cartilage. But these are all not like a permanent solutions. As I already mentioned, when you're like early stages, definitely it works, but not for like advanced arthritis where there is no cartilage left. Grade 2, grade 3, definitely it's a good option.
Thank you, doctor. Thanks for your insight.
Welcome.
Sir, there is another question actually from Mr. Debashish. He is having a stiffness of the knee
Okay.
while he's sitting for a few minutes. How to overcome this problem? That is his question actually.
Stiffness.
Yeah, stiffness.
See, we have to see like what is the reason for his stiffness. So if it is like basically like if it is actually stiffness is like symptom for like a lot of conditions. So even arthritis, you get stiffness and all. There are like multiple things, post-traumatic stiffness. Like we need to see like what exactly is the cause for the stiffness.
Thank you, doctor. Thanks.
Yeah.
And one more thing, one more question in the chat box actually. How effective is the magnetic therapy that is being advertised these days? Because
Yeah.
a lot of new things are coming
See,
in
a
the
lot of that's what like a
YouTube.
lot
Yeah.
of things are like more of like, see, the thing is like most of the times patients they do get very much like no interested when they say like more of non-surgical options. The moment they say surgery, everyone will get scared because in knee replacement they got worried about the initial surgical pain and all. So patient like I see like a lot of advertisement about the magnetic therapy, even the plasma the PRPs are plasma therapy and all. Patient they spend a lot of money, especially in advanced stages and all. See, this magnetic therapy is nothing but any like no, more of like physical therapy, like no more of like external thing. Like no, they do apply a bit of like magnetic field and all. See, all these things like no, they work on the same principle. They work on like no, like no, like you must have heard about this gate control theory of pain. The moment like no, when there are like two nerve endings like no, which carries a if suppose say nerve A is carrying the pain impulse, nerve B is carrying the heat impulse. So spinal cord, there is a gate in the spinal cord which allows only one nerve signal to reach the brain. So when you see this nerve ending, the nerve A which is carrying the pain and nerve B which is carrying the heat impulse. So the nerve the velocity of nerve transmission in nerve B is more when compared to the pain impulse and all. The heat impulse travels very faster compared to a pain impulse. So all these things they work on this sort of principle. So basically all these things more of like a temporary thing. So there is nothing like a permanent solution sort of thing. Definitely, whatever external sources, whatever you want to apply, like doing like IFT, ultrasound, magnetic therapies, all these things, definitely like they are all safe options, but definitely you can do it, but not in advanced stages. We have done like knee replacement for even patient. They have spent a lot of money for magnetic therapy. They come back with the same sort of pain. So like stating that like doctor has spent a lot of money, still the pain is same, and finally they underwent the knee replacement too. But definitely early stages, definitely you can try these options, but they're not going to halt the arthritic thing, and they're not going to rebuild your cartilage inside. Instead of magnetic therapy spending so much of like money on that thing, they can try a simple brace like off-roading brace which will help you.
Thank you, doctor.
Yeah,
Thanks for your insight. I think what you said is prevention is better than cure. Better
yeah, definitely, yes, yeah,
early detection and early treatment. That will be
correct,
the right solution to
yes,
prevent the surgery. That is what you mean to say. Thank you very much, doctor. That is other people are waiting to ask you some question. Mr.
yeah,
Joseph, you are asking something to the doctor. You can ask something.
Hello, can you hear me?
yeah. I can hear you, man. Please tell me.
This is I'm 65-year old. I have a knee injury also,
Okay,
and I thought I have arthritis, but finally I figured out it is not arthritis because of my weak knees,
okay,
and I have varicose veins also. I'm
okay,
overweight. I'll just tell you, I'm 78 kgs at present. I
okay,
have increased weight. I do not know how it got increased. And for me, walking becomes little difficult.
okay,
And climbing stairs, somehow I could do it. But coming down is very difficult to me.
correct,
I
yes,
have to come backwards. If I come backwards, there is no pressure on my knee. If I come forward, there is pressure on my knee. And when I sit and get up, I don't have the strength immediately to stand up.
okay.
So
Is it stiffness?
what
Is it a stiffness or is you feel like lack of energy when you sit for something? Is it
no, I have to immediately. I cannot stand up. I need a support to stand up,
okay?
and I need at least 2 to 3 seconds to take out my feet and keep it to take a step. In fact,
Okay. Uh,
and standing also for a longer time, I require little time to sit. Immediately, I have to sit. I can't stand for more than 5 minutes.
okay. And how about walking? Like, how far can you walk?
I can walk.
So there is no issue while walking. You no pain.
I walk very slowly and yeah, I don't think so. I've never tried walking, so I
Okay.
do not know about it.
See, I
Once I
used.
walked 3 kilometers. That's what I had lots of pain on that day.
Okay.
That's
So that's what. So that means definitely. See, uh, when you take any X-ray and all, like you mentioned, like there was history of injury also. You got some sort of trauma, like there was some injury.
yeah. I had a fracture on my knee.
Okay. What? Okay.
That was more than 10, 15 years ago,
Was it kneecap or
and
the knee, like proper
kneecap.
the
No,
proper?
that is, they said the knee got squished, and that's what the doctor said.
Yeah.
And I had my leg was plastered for 6 months. Then after that, he said, "You are absolutely fine. You can do whatever it is."
Correct.
As it is going on for me now, it is becoming. I can say I am becoming better now. In fact, because I'm doing lots of exercise.
That's a good. That's a good
Yoga,
you're doing. See,
exercise and yoga. I'm doing it. I'm becoming better now. I have to say,
okay.
and I feel that I'm feeling better. But since I met you today, so I thought, why
Yes.
can't I ask these type of questions to you?
Okay. See, one thing is like no, as we grow older, definitely knee joint tends to wear out. So you said like
Yes.
no arthritis, definitely like no. So again, as I said, X-ray we usually say like no, we grade the arthritis. So grade
Yeah.
one, grade two, grade three, grade four, and all. So definitely getting down the stairs if you have a lot of issues, like even walking, you said like you walked 3 kilometers, you got a lot of pain on that day. So that means some sort of arthritis already like it's set in.
I can walk, but when
Yeah.
I walk, I cannot walk. Yes, even if I go for 100, I cannot hold the weight and walk.
Yeah, that's
I
that.
can walk very freely.
So you got your weight bearing exercise, you got the standing exercise, everything. You have seen the doctor, right? You are
Yeah,
telling.
I'm doing it. I've started to do all the exercise,
Yeah, no, you got.
strengthening my knees,
No, you got your
strengthening my
knee
back.
X-rays, knee joint X-rays, scans, anything like.
Knee joint exercise, long time back,
That's
15
what.
years back. I don't know where it is now.
Correct. That's maybe
I
that
said
time.
I became all right. Why I should keep all those things to remember?
Correct. No, if you're having like if your walking distance is fine, I think especially if you're having issues while getting down, getting up the stairs, I feel better to minimize your staircase usage and all. Because as I already mentioned, these sort of activities will increase the load on the knee. Because that's the reason
Okay.
why we tell them like not to sit on the floor, like no, don't do squats and all. So what happens the moment you sit on the floor, the moment you try to get up from sitting to standing, the load on the knee like, is like 10 times the body weight.
No,
So
I don't put. I sit and I have to sit and stand on the floor. But
okay,
when I stand on the floor, I don't put my weight on the knee.
you yeah, you
I
try to
put
put
my
your
weight on my
hands on the
hands and
yes.
my feet.
Correct.
So
That's the other way of
I,
like trying to reduce the load on the knee. But as per se, like these sort of things, even while getting down the stairs, also the load on the knee is 7 times the body weight. So
yeah.
human knee is not designed to take that sort of load. So definitely, the moment no, initial days, definitely we tell them like use the stairs and all that. That will definitely like that is more of like physical activity, but not beyond certain age. Beyond like 45, 50, we tell them minimize these sort of activities. Do some level ground
Okay.
walking, do proper like a quads and hamstring exercises and all those things. But sitting on the floor, squats and using Indian toilet and stairs and all, we tell them to minimize these activities. So which is very bad for the knee because like it puts like a lot of tremendous load on the knee. So the cartilage, that's where the cartilage starts wearing out. I
So
feel
can I go for a walk now?
definitely yes, yes. We always tell them go for a walk with a cushioned footwear. Avoid walking on uneven surfaces. Go with a soft cushioned footwear.
Yeah, and I have a knee cap also, which I wear it. It is very nice,
Definitely, yeah,
comfortable
definitely,
for me.
definitely you can use it. Yes, definitely yes.
Okay, that is something. When I sit on the chair and get up, also I
Yeah,
find it. I
I
cannot get up like
correct.
generally
I
people
feel
get
that is
up.
more of like a stiffness symptom. So one of the symptom of arthritis. I feel you must be having some sort of early arthritis. Yeah, I can't hear though.
Hi, sir. My name is Sampath from Bangalore.
Yeah, please, Miss Sampath. Yeah,
I had a 6, 7 years before PCL complete year. Okay.
PCL tear.
PCL.
PCL, the posterior cruciate. Yeah, yeah.
Yeah. So some doctor they told surgery is not recommended for a PCL. You can go for a rehab and it is not a problem.
Oh no. That is not true. That is definitely not true. See, there are
No.
two important ligaments inside the knee called ACL, PCL, right? Anterior cruciate and the posterior cruciate, which are very important stabilizers of the knee. That's what I was just talking about when I was talking about the modifiable risk factors. Previous injuries, if you got any ligament or meniscal issues, we need to sort out those things. Otherwise, when the ACL, PCL is not there, the knee is not stable. Every time the knee tends to buckle. So PCL is a structure which is there in the back of your knee, which helps in like preventing the knee, like the knee to go backwards. The moment the PCL is not there, it tends to buckle every time. Okay, the movement happens like this. So that's where the articular cartilage tends to get damaged. So it is not if you got a complete PCL tear, definitely that has to be like reconstructed.
Yeah. No, like 2 months before I had severe pain.
Okay.
So I've been to like a doctor. They told you're starting into early arthritis. Okay.
Arthritis, definitely, yes, yeah.
So I want to know what is mean by awareness strength test positive
Okay.
postal draw test positive. It has been.
That's what. Correct.
I'm
Yeah.
having PCL complete PCL tear also.
Yes, yes. No, these are the we call it as a posterior drawer. We call it as a reverse pivot and the so there are certain tests to check the clinical stability in the outpatient department. When a patient comes to us with any knee injury, we always check for the integrity of the knee ligaments and all. Like we call anterior drawer for the ACL, the posterior drawer is for the PCL, which tests the knee joint stability. If you have a PCL like a posterior drawer thing, and they are definitely like if the MRS has a PCL tear, the definitely reconstruction is the only solution.
Sir, like this regenerative stem cell, it will not help me.
No, it won't. It won't. It won't. Like see, stem cells, as I said, right? So, especially all these, like there are a lot of things like we call it as a AC or a like autologous condensate replay, like all this implantation and all. So, what we do, we take cartilage from the healthy part. So, if you see the knee cartilage, right? This is the weight bearing portion. When it comes to the side, there is a non-weight bearing portion. We got cartilage. If you have any focal defects like this, we can take the cartilage from healthy, like non-weight bearing portion to, and we can transfer the same cartilage to the weight bearing portion. That is especially we do for focal cartilage defects, not in arthritis, for focal cartilage defects. So that for especially in sports persons, these sort of things happen.
Okay.
Yeah. So and what's
you
your
very
age now?
My age is now 34, sir.
So you need to undergo that thing. Whatever if it is early thing, also better to reconstruct the PCL.
Okay, sure. Thank you very much, sir.
Yeah.
ಸರ್ ಇನ್ನೊಂದು ಕೇಳ್ಬೇಕಾಗಿತ್ತು ಸರ್, ನನ್ ಮರಿಯಾ.
ಹೇಳಿಮ್ಮ.
ಸರ್ ಇವಾಗ ನಾವಿರೋದು ಫಸ್ಟ್ ಫ್ಲೋರ್ ಅಲ್ಲಿ.
ಓಕೆ.
ಏನಂದ್ರೆ ಇವಾಗ ಹತ್ತಕ್ಕೆ ಇಳಿಯೋಕ್ಕೂ ತುಂಬಾ ಕಷ್ಟ
ಆಗುತ್ತೆ. ಕರೆಕ್ಟ್.
ಹೇಗ್ ಹತ್ತೋದು ಹೇಗ್ ಇಳಿಯೋದು ಏನಾದ್ರು ಸಮ್ ಐಡಿಯಾಸ್
ಅದೇ
ಕೊಟ್ರೆ.
ಕರೆಕ್ಟ್ ಬಟ್ ದಟ್ಸ್ ವಾಟ್ ಯೂಶುವಲಿ ಸ್ಟ್ರೈಟ್ಸ್ ಇದೆಲ್ಲ ಲೈಕ್ ಡೆಫಿನೆಟ್ಲಿ ಇಟ್ ಹ್ಯಾಸ್ ಗಾಟ್ ಲಾಟ್ ಆಫ್ ಇಂಪ್ಯಾಕ್ಟ್ ಅಂತ ಇದು ಮಂಡಿ ಮೇಲೆಲ್ಲ. ಸೊ ದಟ್ ಆನ್ ಟಾಪ್ ಆಫ್ ದಟ್ ನೀವು ರಿಮೋಟಾಯ್ಡ್ ಕಂಡೀಷನ್ ಅಲ್ಲ, ರಿಮೋಟಾಯ್ಡ್ ಆರ್ಥರೈಟಿಸ್ ಅದು.
ಹೌದು.
ಒಂದ್ಸತಿ ಒಂದು ಎಕ್ಸ್ರೇ ಒಂದು ಮಾಡಿಸಿ ನೋಡೋಣ. ಅದು ಎಕ್ಸ್ರೇದಲ್ಲಿ ಅಷ್ಟು ಮೋರ್ ಆಫ್ ಲೈಕ್ ಮಿಡಲ್ ಕಂಪಾರ್ಟ್ಮೆಂಟ್ ಆರ್ಥರೈಟಿಸ್ ಆದ್ರೆ ಸೊ ಬೆಟರ್ ಯು ಕ್ಯಾನ್ ಗೋ ಫಾರ್ ದಿ ಸಾರ್ಟ್ ಆಫ್ ಬ್ರೇಸಸ್. ಡೆಫಿನೆಟ್ಲಿ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ ಇದು. ಬಟ್ ಮಿನಿಮೈಸ್ ದ ಸ್ಟೇರ್ ಕೇಸ್ ಅಂತೀವಿ ನಾವು. ಬಟ್ ಫಸ್ಟ್ ಫ್ಲೋರ್ ಇಸ್ ನಾಟ್ ಎ ಮೇಜರ್ ಕನ್ಸರ್ನ್ ಇದು. ಸೊ ಬಟ್ ನಥಿಂಗ್ ಲೈಕ್ ದೇರ್ ಇಸ್ ನೋ ಸರ್ಟನ್ ಲೈಕ್ ಈ ತರ ಪೊಸಿಷನ್ ಈ ತರನೇ ನಡಿಬೇಕು ಆ ತರ ಏನಿಲ್ಲ. ಐ ಡೋಂಟ್ ಥಿಂಕ್ ದಟ್ ಡಸಂಟ್ ಮೇಕ್ ಎನಿ ಡಿಫರೆನ್ಸ್ ಅದು. ಬಟ್ ಮೆಡಿಕೇಶನ್ ತಗೊಂತಾ ಇದ್ದಾರೆ, ರಿಮೋಟಾಯ್ಡ್ ಮೆಡಿಕೇಶನ್
ತಗೊಳ್ತಾ ಇದೀನಿ ಡಾಕ್ಟರ್. ಅದೇ ಏನಂದ್ರೆ ಒಂದೇ ಏನಂದ್ರೆ ಇವಾಗ ಅದು ಸ್ಟೀರಾಯ್ಡ್ಸ್ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಕೊಟ್ಟಿದ್ದಾರೆ ನನ್ಗೆ, ವೈಸ್ಲಿನ್ ಕೊಟ್ಟಿದ್ದಾರೆ, ಮತ್ತೆ HCQ ಕೊಟ್ಟಿದ್ದಾರೆ. ಇದು ಎರಡು ಕೊಟ್ಟಿದ್ದಾರೆ, ಹಂಗಾಗಿ ನಂದು ವೇಟ್ ಜಾಸ್ತಿ
ಸ್ಟೀರಾಯ್ಡ್ ತಗೊಂಡಿದ್ರೆ ಡೆಫಿನೆಟ್ಲಿ ವೇಟ್ ಗೇನ್ ಆಗ್ತಾರೆ ಡೆಫಿನೆಟ್ಲಿ. And steroids are known to cause bit of like systemic steroids ತಗೊಂಡಿದ್ರೆ so it will cause osteoporosis also.
ಹೌದು.
ಮೂಲದಲ್ಲಿ ಕ್ಯಾಲ್ಸಿಯಂ ಎಲ್ಲ ಕಡಿಮೆ ಆಗ್ತಾ ಇರುತ್ತೆ ಅದು.
ಹೌದು.
ಪ್ರಾಬ್ಲಮ್ ಇಸ್ ಲೈಕ್ ಎಲ್ಲಿ ರಿಮೋಟಾಲಜಿಸ್ಟ್ ತೋರಿಸ್ತಾ ಇದ್ರಮ್ಮ?
ಬ್ಯಾಪ್ಟಿಸ್ಟ್ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ತೋರಿಸ್ತಾ ಇದೀನಿ ಡಾಕ್ಟರ್.
ಓಕೆ. ಬಟ್ ಇವಾಗ ಸ್ವಲ್ಪ ಬೆಟರ್ ಮೆಡಿಸಿನ್ಸ್ ಎಲ್ಲ ಇದೆ. ಯು ಕ್ಯಾನ್ ಸಿ ಬೆಟರ್ ರಿಮೋಟಾಲಜಿಸ್ಟ್ ಇವಾಗ ಮೋರ್ ದನ್ HCK ಸ್ಟೀರಾಯ್ಡ್ಸ್ ಗೆ ಇನ್ನು ಬೆಟರ್ ಆಪ್ಷನ್ಸ್ ಇದೆ ಈಗ. ಲೈಕ್ ಪ್ರೊಫಾಸ್ನಿಬ್ ಅಂತ ಮೋರ್ ಆಫ್ ಲೈಕ್ ಪ್ರೊಫಾಸ್ನಿಬ್ ಇವನ್ ದೀಸ್ ಸಾರ್ಟ್ ಆಫ್ ಥಿಂಗ್ಸ್ ಡೆಫಿನೆಟ್ಲಿ ವಿಲ್ ಹೆಲ್ಪ್ ಯು. ಈ ತರ ಇಶ್ಯೂ ಇದೆ ನಿಮ್ಗೆ ವೇಟ್ ಗೇನ್ ಇದೆಲ್ಲ ಡೆಫಿನೆಟ್ಲಿ ವರ್ಕ್ ಆಗುತ್ತೆ.
ಓಕೆ ಡಾಕ್ಟರ್, ಅದೇ ನಾನು ಬಂದು ಭೇಟಿ ಆಗ್ತೀನಿ ಡಾಕ್ಟರ್ ನಿಮ್ಮನ್ನ.
ಡೆಫಿನೆಟ್ಲಿ.
Okay, thank you.
Fine.
Hello, doctor.
Hi.
Hello, doctor. Me Shabana from Bangalore.
Yeah, hi, Shabana.
Sir, I'm 40 plus.
Okay.
And from last year, I am having knee pain. 2023 August. I don't know, and I'm like continuously, if I'll stand in the kitchen for 2 to 3 hours, it pains a lot, sir. And sometimes it burns, like you won't be able to bear that burn. Burning is there inside the side.
See, one thing is like when standing causing a lot of pain, so we always think about might be like early arthritic symptom because weight bearing you are getting symptoms and all.
Yes.
See, nowadays like I am seeing in clinical practice even early 40s we are seeing like patients with more of like middle compartment arthritis and all. Maybe because of dietary factors, maybe food adulteration, multiple things are there. But unfortunately, maybe because sometimes we see like fluoride issues also in the water that can cause like early wear and tear and all. So when you are having pain on weight bearing, so better get an exercise, standing exercise, as I mentioned, at least to see what sort of stage it is in now. Any injury in the past? Any injury like anything like?
No, nothing.
Nothing, right? Yeah.
Nothing. Just started from last year.
Yeah. So and it is a constant one, or the pain is getting worse?
No, constant means from like 2 3 days it will be constantly, it will be pain. If I
Okay.
lie down also, if I sleep also, it start pains. But
Any
some
stiffness? Stiffness. How is the
uh,
pain while walking? How is the pain while walking?
like I can feel it that something is like touching each other.
Yeah, okay, yeah, that's what. So, and what's your BMI? Approximate BMI?
I will
Weight, body
check.
weight? Yeah,
Like 60 57, doctor.
not like two.
Yes.
Yeah, that's what. So I feel like better to take in standing X-ray because if you are having issue with your weight bearing thing, so better take on X-ray of the knee, standing X-ray. At
Okay.
least depending on that, we can tell you like we can give a like a proper suggestion and all.
So that X-ray I can bring it to your clinic,
Yeah,
right?
definitely,
There.
yes, yes, definitely, yes.
So you are too, right?
So I'm in Vartur, yes, Manipal Vartur, yes.
What about this nearby? Any MG Road and all nearby?
Oh no, no,
Manipal, Hibal,
no,
Manipal.
no, no. You can see any orthopedician over there. Anyways, one of our team
No, but
doctors.
speaking with you is like
Okay,
relaxable, so I can meet. I
okay, fine.
can
Definitely. I
come.
think Vartur anyways, like Vartur definitely, but I have clinic in Kerala, that is quite far for you.
Yes, exactly,
I
sir.
think
What
Vartur
time
is
will be
a
there,
little better.
sir? What time you will be there in that
Manipal, I'll
clinic?
be there like daily. I'll be there daily, Manipal.
Okay, I can see. I can call
Yeah,
and like
definitely. Yes, please. Yeah, definitely, yes.
standing X-ray. You asked me, right?
I need a standing exercise, definitely, yes.
Okay, sir. Okay, thank you. Sir, your name?
I'm Dr. Dinesh.
And your number we'll get. Can we get
Yeah,
your
definitely.
number?
Yeah, definitely, yes.
Madam, we are going to show it after the webinar. Okay, we will share it in the group also, WhatsApp group also. Don't worry about it. We'll give the contact details, everything.
Okay,
Sir,
thank you.
Sir, good evening, sir.
can you share Kerpuram clinic number
Yes, sure, definitely.
address, sir?
We will display all the addresses. Even I will share both the addresses, Vartur as well as contact as well as this one. Vartur already,
Okay.
I think you know that. Clinic address, we will share it. Don't worry about it.
Okay, sir.
In the
Thank
group.
you.